Is it normal to have some leakage? It is common for patients to leak some of their enema contents after use. This usually settles as your symptoms of active colitis begin to resolve. If you do experience leakage, you may find it useful to use the enema earlier in the evening so that you can have a shower before going to bed. Some patients find it useful to wear an incontinence pad so they do not have to worry about leakage during the night. If my symptoms get better, do I have to continue to use the enema? It is generally recommended that you continue with your enema therapy until you have 7 days of no symptoms, unless advised otherwise by your doctor or specialist nurse. You may find it useful to keep a supply of enemas at home, so if you have any signs of rectal bleeding, you can recommence your therapy immediately. You should let your hospital team know if your symptoms fail to settle. Is it normal to feel pain when using the application? You should not feel any pain when using the applicator. It can feel uncomfortable, but this can be relieved using lubricant on the applicator or by running warm water over the applicator before use. You should try and be as relaxed as possible during administration. Is it normal to have some bleeding when using the enema? You shouldn't experience any rectal bleeding on insertion of the enema. However, when you pass the contents of the enema in your next bowel movement, you may notice some blood then. This may be in the toilet bowl or within the stool. This is normal. If the amount of blood you pass increases, you should speak to your doctor or specialist nurse. I find it very difficult to keep the liquid foam in for very long before I need to go to the toilet. It's common when people first use their enemas to get a sensation that they need to go to the toilet immediately. You should continue with your therapy even if this happens, as you'll still get some benefit from the enema, and usually over a period of a week or so, your ability to retain your enema will increase. To increase the likelihood of retaining your enema, you should relax as much as possible. Best results are obtained if you empty your bowel prior to administering your enema. Put a towel on your bed and try to take your mind off the pressure you may feel in your back passage. You could try reading, listening to music, or watching some television if possible. If you're still experiencing problems after a week or 10 days, you should speak to your specialist team.